Hey everyone, so I just finished probably one of my favorite rotations here at the clinic. It's a clinic in a less fortunate area where there's grant money that allows patients in this underserviced community to come and receive treatment, not just for pain-related conditions, but patients can come for blood pressure checks, manage their diabetes, any GI dysfunction, pain, anything like that, as well as musculoskeletal complaints. And so on this rotation, I oversee a lot of students who are managing these patients' condition as they're learning and being overseen by the physicians. And this is probably one of my favorite shifts for a few reasons. The first is that the patients here, because they come from an underserviced area, an underserviced community, they appreciate what we do here and how we help them on a completely different level than when someone comes in and is paying for their healthcare, which is an interesting notion to think about. However, it blows my mind how caring and how much these patients really appreciate what we can give them. I also love this rotation because I get to teach the students some of the regenerative injections that I do, such as perineural injection therapy and prolotherapy, and we use ultrasound guidance for some of those as well. And so we had a patient come back today. We had seen him about 3 months ago for some low back pain. Today we were seeing him for his shoulder. And so we followed up on him, and 3 months ago I had done and taught a student how to do lumbar facet injections and multifidi injections under ultrasound. The patient was having chronic low back pain that had started about 2 years prior. He's a rancher, so it was affecting his work. For those of you who don't know, a rancher is someone who's going to work kind of on a farm with livestock. Specifically, he handled horses. And so anyways, he had right-sided pain that extended down into his back a little bit, was worse with twisting motions, which is one of the more classic symptoms for facet syndrome. And so we had treated the facet joint, the capsule around the facet joint, and also, and this is really important, treated the multifidi that are in the lumbar region, which are going to be huge spinal stabilizers. And oftentimes with chronic low back pain, they don't fire as quickly, and so they can cause some destabilization in the lower spine and even the cervical. And so we treated those as well. And he had one prolotherapy treatment, and he came back today and he was 95% better, and he was actually coming in for his shoulder. So his shoulder we end up also treating with some prolotherapy. We think he may have a slap tear, so we may need to get imaging at some point if he doesn't respond to our conventional treatment, which is going to be prolotherapy. And then we also saw some tendinosis, so some thickening of the tendon and a little bit of cartilage defects and some osteochondral defects along the bone, where both in the joint and also where the supraspinatus was attaching. And so there's some supraspinatus tendinopathy going on, and so we also treated that with the prolotherapy. So I'm excited to see how he does. I'm excited to share this with you. I didn't expect to film this video, but as part of my filming, I'm trying to get more spontaneous and sharing kind of what's going on in my life so that I can share that with other people. This will probably end up on YouTube, so if you're there, thank you for listening. If you could leave a comment, I want to hear from you. And if you can, subscribe and share this around. Thanks, everybody.